There's a type of heart disease that some people are born with, and it shapes their health for life. The care that they need changes as they grow, and some milestones come with a little extra risk, too. It's why having a strong team matters. Registered nurse Chantel Bardra from Lee Health is one of those experts, and she is here in our studio with us. This is Heart Health Month, after all. Thanks for being here.
Thank you for having me. I appreciate the opportunity.
I appreciate you being here and all that you and your team do. A lot of people, I don't think, realize exactly what congenital heart disease is. We hear about people getting something later in life, but this is with somebody from the day they're born.
Correct. So congenital heart disease refers to when a patient is born with an abnormality in the heart. And so this occurs because the heart does not form or develop properly during the pregnancy, and it can result in structural abnormalities of the heart itself. So things like abnormal heart valves, abnormalities to the blood vessels in or around the heart, or defects within the walls that separate the chambers of the heart.
How is that diagnosed? Is it something that you know right away with your baby, or is it something you find out later?
Yeah, fortunately now we have a lot of new technology and innovation. So actually many children are diagnosed prenatally, especially for severe forms of congenital heart disease.
Wow.
So doing something called a fetal echocardiogram, which is a special ultrasound that is done to look at the heart in detail, it can be diagnosed that way. Other times it is diagnosed after the child is born, and usually that occurs because the pediatrician sees or hears an abnormality in heart sounds, or can just see a change or an abnormality in physical exam, and refers the child or baby for an ultrasound of the heart or an echo. And we have a lot of other tools to look at the heart in more detail, things like CTs and MRIs to confirm diagnosis.
How do you manage that if once you have a child or yourself, if you have the diagnosis?
Yeah, congenital heart disease varies tremendously. It's really a spectrum of disease. So there are very complex forms of congenital heart disease and simpler forms. So some babies and children can just be observed or watched, but others do need surgeries or interventions even pretty soon after they're born. And so it just depends widely on the type of heart defect, but at times, yes, surgeries or catheter-based interventions are needed to treat the specific type of defect or lesion.
I know that we have at Lee Health, an entire heart team that pretty much covers from A to Z, the things that you need. How exactly can people get in touch with all of you, the resources, and understand what we have in our community?
Sure. So if you visit leehealth.org, and we have a webpage both for the congenital heart disease program, which includes both fetal, pediatric, and adult congenital, as well as through our Heart Institute. There's information there as well.
Oh, great. Thank you so much, and thank you for what you do. We really appreciate you coming in. And this is registered nurse Chantel Bardra, and if you want to learn more, as mentioned, there's some information for you. You can keep your heart healthy and have an active lifestyle. We have had this full month worth of segments on our Gulf Coast News app and website if you'd like to take a look back at some of this wonderful information and some of the resources we have in our community. It is